Hello, my name is Jocelyn, and I will be presenting on continuous quality improvement, a targeted approach to improving care. The methods that are going to be used are continuous quality improvement and evidence-based practice, with a commitment to improve the quality of care, both sharing a common goal of quality and a culture that fosters and enhances safety. QI and EBP both focus on the same goal but different parts of the problem. Evidence-based practice is about doing the right things. Quality improvement is about doing things right. Established practices that will result in the best patient care are presented by both parts of these methods. This allows improvement in patient care outcomes, improved efficiency, and decrease in costs. So what is our project and what is our goal? Our goal is to create a change in our supply chain process and how we approach and provide services to our neonatal alcohol syndrome population and drug-addicted mothers through early detection, prevention, and education. The outcomes for this are demonstrated through this process map. We are able to provide identification, interventions, treatment, monitoring, and outcomes with considerations to each stakeholder. So our stakeholders, why do you matter? Well, who is our most common stakeholder we can all agree on? Our consumer, our patient, our targeted at-risk population. Despite your level of involvement, where we can agree on is that our participation in this initiative is to help people live healthier lives and to help make the healthcare system work better for everyone. So this is why all of you matter in the participation of our project. Your involvement and support is vital to the success of our project plan, with our consumers being the center of our measure of success and outcomes. Considerations of our CEO and COO of our managed care organizations is of high importance because we hope this new process will decrease costs to our Medicaid program. Our CEO and COO will be able to evaluate the current reimbursement structure, which is currently below intermediate for substance abuse services. This project will satisfy our organizational core values of compassion, relationships, innovation, performance, and integrity. Considerations for the Department of Health, specifically the Family Health Bureau, satisfies our epidemiologists and our perinatal collaborative throughout the state. Their support is vital in health and well-being of our state and improved outcomes. Additionally, the support of our contracted state hospitals, both metro and rural areas, as they receive reimbursement for care, and due to low staffing, suffer from ability to deliver care in rural areas. This comes at a high cost to our MCO for patients that need to be transferred to level 2 or level 3 facilities. Next, the combination of CYFD, providers, and preventative health services for our population that receive reimbursement funding through grants and state waivers. Their ability to support and participate will allow us to create a tool based on evidence-based screening and continued development of centers that provide core services from community to community. As the project continues to evolve, we will keep our managers, our service coordinators, and the public in constant communication with advancements in our project and how it will aid in their direct contact with our consumers. With hopeful success, the long-term result will be gratifying to our shareholders and our county commissioners who determine county appropriations and expenditures in the development of additional programs to our at-risk population. This project management plan concludes with serving our mission. So as far as our timeline, we understand it must be measurable and realistic. Our short-term goal, we have created subcommittees that will meet starting December 19, 2017 with their completed responsibilities for discussion. We are broken up into 3 subcommittees. One subcommittee that will focus on training. The second subcommittee will focus on resources. And our third subcommittee will focus on our long-term goal. That also will have an effect on the cost of this population on our MCO. Our long-term goal is for this NAS project to reach our rural hospitals, however we are currently in pilot phase. This is for expansion of our project into these communities to provide education and training to skilled staff, which has a long-term goal of decreasing costs to our MCOs for unnecessary transportation and admissions to higher acuity hospitals. In order to communicate this plan, we are considering all stakeholders. After the initial meeting and pitch of this project, we will send out invitations via email to all stakeholders to participate in the collaboration of each phase of the project. We will provide face-to-face meetings in our local office with the option for a conference call-in for those unable to participate otherwise. For internal stakeholders, we will provide a summary of the program's process during our monthly community and state all-employees meeting via webinar. For external stakeholders who may opt out of continuous meeting participation, such as stockholders and county commissioners, we will provide progress of our project through a newsletter. Once our project goes live, there will be a webinar training that is provided, as we do with all of our pilot programs. And from then on, we will measure our success based on certain measures. Our focus is our organizational value of relationships. We understand we must positively engage the efforts and interests of everyone who is touched by and contribute to that effort. We will actively engage with people and institutions to share information, ideas, and resources in order to help others achieve their goals. We will encourage the variety of thoughts and perspectives that reflect the diversity of our markets, customers, and workforce. The community and population we are serving. Our project success will be evaluated by the most important stakeholders of all, our consumers and our patients we are serving. We will evaluate with 1 year if there was at least a 10% decrease in hospital admissions related to NAS through our project. Thank you.